First, we will recap some information from our last video defining trauma and trauma-informed care. Traumatic experiences can be a threat to life or safety, or really any event that leaves you feeling overwhelmed and isolated. Some examples can include accidents or injuries, living in a crime-ridden neighborhood, major surgeries, bullying, the sudden death of a loved one, or a humiliating experience. Before learning how to help yourself or others through trauma, it's important to understand the symptoms. Some emotional symptoms include shock or denial, confusion, anger, anxiety or fear, guilt, sadness or hopelessness, and feeling numb. Some physical symptoms include insomnia or nightmares, fatigue, difficulty concentrating, agitation, aches and pains, and muscle tension. And lastly, trauma-informed care seeks to avoid re-traumatization through education of self-coping mechanisms and resources to help oneself and others, which is what we will be discussing today. We will start by explaining some ways on how to help yourself through trauma. First, move your mind and body. Exercise can help you release endorphins and even repair your nervous system from ongoing trauma symptoms, which we explained earlier. Exercise for at least 30 minutes a day, and try rhythmic exercise that uses both your arms and legs. These include walking, swimming, basketball, or dancing. Also use mindfulness. Instead of focusing on your thoughts, focus on your body and how it feels as you move. Practicing mindfulness is becoming increasingly common for reducing anxiety and stress. So, when you have unwanted or stressful thoughts, start by moving individual parts of your body. You can start from your toes and work up to your head, and focus on how your muscles and skin feel. You can do this sitting, laying down, or during an activity. Some activities like rock climbing or boxing can make it easier since you need to focus so much on your body to prevent injury. Second, do not isolate yourself. This doesn't necessarily mean you have to talk about your trauma, but you can ask for support, even talking to someone who will listen without judgment. You can also participate in social activities, reconnect with old friends, or try making new friends, join support groups, and volunteer. Third, self-regulate your nervous system. This can be done in a couple of ways. You can use mindful breathing. For example, for 1 minute, breathe in for 8 seconds, hold for 4 seconds, and breathe out for 8 seconds, and repeat as much as needed. Another way is sensory input, maybe petting an animal or listening to your favorite music. And last is staying grounded. An example of this is the 5-4-3-2-1 technique. This technique is a way to stay grounded. To do this, you look around the room or environment you're in and identify 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This technique can help slow your breathing and reduce any feeling of panic, anxiety, or stress. The fourth and final strategy for helping yourself through trauma is taking care of your health. Get plenty of sleep, avoid alcohol and drugs, eat a well-balanced diet, and try to reduce stress with some of your favorite activities. These could be hobbies, yoga, deep breathing, or anything else that makes you feel happy and relaxed. The previous strategies we have provided are meant to help reduce those trauma symptoms that we described in the beginning of the presentation, but sometimes that's not enough. So here's when to seek professional help. If you're having trouble functioning at home or work, suffering from severe anxiety or depression, unable to form or keep close, satisfying relationships, experiencing terrifying memories or nightmares, feeling emotionally numb and disconnected, or using alcohol or drugs to feel better.
Now we're going to talk about ways to help others through trauma. First, it is important to be patient and understanding during these times, as healing from trauma can take time. It is also important to not be judgmental because everyone responds to trauma differently and at their own pace. Just work through it with the individual and let them know that you are there for them. Next, you can offer practical support. You are not expected to solve all of the individual's problems, however, you can still offer support when help is wanted or needed. Getting back into a normal routine is both helpful and therapeutic. You can help someone get back into a normal routine by encouraging or helping with grocery shopping, completing and helping with housework, helping care for children, and just being available to talk or listen at any time. Next, don't pressure someone to talk. It can be difficult for trauma survivors to talk about what happened, so do not force them to open up to you. Instead, let them know that you are there for them if they want to talk. If the individual does not want to talk, be available to hang out with them and instead focus on something else to help them take their mind off of it. Help them to socialize and relax. You can encourage them to exercise, spend time with friends, and participate in their favorite hobbies. You can also do these activities with them, like setting up a regular dinner date with friends or walking the dog each day together. Next, do not take their trauma symptoms personally. Trauma survivors may feel angry, withdrawn, sad, or irritable at times. These reactions are a result of the trauma and may have nothing to do with you or your relationship. Do not question their response or state that they should have done something differently. Individuals enter fight or flight mode after having experienced trauma, and the main goal becomes survival. There is no right or wrong response. Be supportive and listen without judgment. You can respond with the phrase, "I'm sorry to hear this happened," and let them know that you are here for them during this difficult time. Encourage individuals to speak to a professional. Trauma can be very complex and may require help from a mental health professional. Encourage those you know to reach out to a professional if they are struggling after trauma, and let them know that it is okay to seek help. In addition to ways you can help others through trauma, we wanted to talk about several ways to help children through trauma as well. Your child may experience regression, which can result in wetting the bed or wanting a bottle even though they have developed past these milestones. It is important to be patient and comforting when they respond this way. A child may think that the event is their fault. This is common for children under the age of 8. Make sure they know that they did not cause the event and show understanding during this time. A child may also present sleep difficulties and may struggle to fall asleep or stay asleep. You can give them a stuffed animal or a soft blanket to help them feel more secure when they are falling asleep. You can also put a nightlight in their room or read to them before bed to help them with the sleep process. A child may feel helpless, and in this case, you can work with others to prevent the event from happening again and thank those individuals that have already helped. Now we have provided local resources in the Pittsburgh region. All links will be provided in the description of this video for access to these resources. The first resource is called Trying Together, and it is a trauma resource for families that provides links to many different trauma resource centers in Pittsburgh and the surrounding areas. The next is Trauma Survivors Network, which is a community resource that lists aid for lodging, transportation, food, housing, childcare, and pet care. The Allegheny Health Choices is a PDF article that outlines symptoms of trauma and different coping mechanisms, as well as the journey to recovery from trauma. It also provides a list of local community resources for receiving aid. The Center for Victims is a community-based nonprofit organization for victims of all crimes and healing through trauma. The UPMC Mental Health Hotline provides a 24/7 crisis network phone number in which you can talk to a counselor. The number provided is 1-888-7-YOU-CAN or 1-888-796-8226. The Early Childhood Mental Health and Trauma Center is a resource for children dealing with trauma. They offer diagnostic assessments, child parent psychotherapy, parent-child interaction therapy, as well as child-focused individual play therapy. The Help Pittsburgh resource offers aid for children, youth, and families that have experienced trauma by offering contacts and resources for keeping children safe in the local community. Finally, we have also listed some national trauma care resources. The National Suicide Prevention Lifeline is a 24/7 hotline that may be called at 1-800-273-8255. The National Center of Substance Abuse and Child Welfare lists resources for adults and children who have experienced trauma as well. The Substance Abuse and Mental Health Services Administration provides resources for child trauma-informed care, including bullying, child welfare, drug addiction, domestic violence, early childhood education, and more. And finally, the National Child Traumatic Stress Network provides resources and a 24/7 hotline for children that have experienced trauma and ways to get help.